Hello, all you amazing medical explorers, and welcome back to Life of Medical. I'm your guide on this journey through the wonders of medical technology. Tonight, we're tuning into a device that uses the power of sound to give us an incredible window into the human body, the ultrasound device. Our episode is called Echoes of Health, Understanding the Ultrasound Device and How Sonograms Let Us See Inside. From watching a baby grow to examining vital organs, ultrasound is a safe and versatile hero in the world of medical imaging. So let's dive in. What is an ultrasound device and what are sound waves in this context? First off, what exactly is an ultrasound device and what are these special sound waves it uses? An ultrasound machine is a diagnostic tool that uses high-frequency sound waves far beyond the range of human hearing to create images of the inside of the body. These images are called sonograms or ultrasounds. Think of it like medical sonar. The device consists of a computer console, a display screen, and a handheld probe called a transducer. This transducer is the key. It emits the ultrasound waves and also detects the echoes that bounce back from internal structures. Unlike X-rays or CT scans, ultrasound imaging does not use any ionizing radiation, making it exceptionally safe. These sound waves travel through different body tissues at varying speeds and are reflected back differently, allowing the machine to distinguish between organs, fluids, and other tissues, painting a dynamic, real-time picture. How does an ultrasound device work to create images, sonograms? So, how does an ultrasound device actually transform invisible sound waves into those detailed images we see on the screen, known as sonograms? The process is quite ingenious. The technologist applies a special gel to your skin over the area being examined. This gel helps to eliminate air pockets between the transducer and the skin, allowing for better transmission of the sound waves. The transducer then sends out pulses of these high-frequency sound waves into your body. When these sound waves encounter a boundary between different types of tissue, like the boundary between fluid and soft tissue or soft tissue and bone, some of the waves are reflected back to the transducer as echoes. The transducer detects these returning echoes, noting their intensity and the time it took for them to return. The ultrasound machine's computer then instantly processes this information, calculating the distance and density of the reflecting structures to create a live, moving image on the monitor. It's a sophisticated interplay of physics and computing. Where are ultrasound devices commonly used beyond just pregnancy? When people hear ultrasound, many immediately think of pregnancy. But where else are ultrasound devices commonly used? While obstetrics is a major application, ultrasound is incredibly versatile and utilized across numerous medical specialties. In cardiology, echocardiograms, ultrasounds of the heart, are essential for assessing heart function, valves, and blood flow. Abdominal ultrasounds are used to examine organs like the liver, gallbladder, to look for gallstones, spleen, pancreas, and kidneys. Vascular ultrasound helps visualize blood vessels to detect clots or blockages. Musculoskeletal ultrasounds can assess tendons, ligaments, muscles, and joints for injuries or inflammation. Urologists use it to examine the bladder and prostate. It's also used to guide procedures like biopsies, ensuring a needle is precisely targeted. Emergency medicine relies on fast, focused assessment with sonography for trauma, scans to quickly detect internal bleeding. Its portability also means it can be brought to the patient's bedside or used in remote settings. When is an ultrasound typically the imaging method of choice? This leads us to the question, when is an ultrasound typically the imaging method of choice for doctors? Ultrasound is often preferred when real-time imaging of soft tissues and blood flow is needed, especially when avoiding radiation exposure is a priority. It's the go-to for monitoring fetal development throughout pregnancy because of its safety profile. For examining organs in the abdomen and pelvis, particularly those containing fluid or soft tissues like the gallbladder, kidneys, liver, ovaries, and uterus, ultrasound provides excellent detail. It's highly effective for evaluating lumps or masses to determine if they are solid or fluid-filled cysts. In cases of suspected DVT, deep vein thrombosis, Doppler ultrasound, which can assess blood flow, is a primary diagnostic tool. For guiding minimally invasive procedures, such as needle biopsies or fluid aspirations, the real-time visualization offered by ultrasound is invaluable. Its non-invasiveness, relatively low cost, and portability also make it a first-line choice in many diagnostic pathways. Why is ultrasound considered such a safe and versatile imaging technique? Why is ultrasound considered such a safe and versatile imaging technique, making it so popular in medicine? The foremost reason for its safety reputation is that it does not use ionizing radiation, unlike X-rays or CT scans. This means there's no associated risk of radiation-induced harm, making it ideal for sensitive patients like pregnant women and children, and for repeated examinations if necessary. Its versatility stems from its ability to visualize a wide array of soft tissues and to assess blood flow using Doppler techniques. Ultrasound machines can be equipped with different types of transducers, each designed for specific body parts or depths, allowing for tailored examinations. Furthermore, ultrasound provides dynamic, real-time imaging, allowing clinicians to observe movement, such as a baby's heartbeat, blood flowing through vessels, or the function of heart valves. The equipment is also relatively portable and less expensive than other advanced imaging modalities like MRI or CT, increasing its accessibility in various healthcare settings. Who performs ultrasound scans and interprets the images? Understanding who is involved in conducting an ultrasound and making sense of the images is important. The healthcare professionals who perform ultrasound examinations are typically called sonographers or ultrasound technologists. They are specially trained in operating the ultrasound equipment, obtaining high-quality images, and understanding the anatomy and physiology relevant to the scan. They work closely with patients, explaining the procedure and ensuring their comfort. While sonographers can identify normal anatomy and certain abnormalities during the scan, the official interpretation and diagnosis are made by a radiologist or another physician with specialized training in ultrasound imaging, such as a cardiologist for echocardiograms or an obstetrician for pregnancy scans. This physician reviews the images and any accompanying clinical information to provide a comprehensive report to the referring doctor, who then discusses the findings and treatment plan with the patient. Ultrasound safety, is it really risk-free? A common question is, ultrasound safety, is it really risk-free? For diagnostic purposes, ultrasound has an excellent safety record and is generally considered risk-free when used appropriately by trained professionals. Decades of extensive research and clinical use have not shown any confirmed adverse effects on patients, including developing fetuses, from diagnostic ultrasound exposure. The sound waves used are of relatively low intensity. However, like any medical procedure, it should only be performed when medically indicated. While there are no known risks from the sound waves themselves in diagnostic settings, prolonged exposure to high-intensity ultrasound, which is not used in standard diagnostic imaging, can potentially heat tissues. This is why sonographers are trained to use the lowest necessary power settings and limit scan times appropriately, following the ALARA, as low as reasonably achievable principle, though more strictly applied to radiation. The concept of prudent use applies here too. So, for standard diagnostic scans, you can feel very confident about its safety. Preparing for your ultrasound scan. What to expect. Knowing what to do before your scan can be helpful, so let's talk about preparing for your ultrasound scan. What to expect. Preparation for an ultrasound varies significantly depending on the type of scan being performed. For some scans, like those of the gallbladder or liver, you may be asked to fast, not eat or drink anything except water, for several hours beforehand to ensure the organs are not obscured by food or gas. For pelvic ultrasounds, including early pregnancy scans or examinations of the bladder, you'll often be asked to drink several glasses of water an hour or two before your appointment and to avoid urinating. A full bladder helps to push the bowel out of the way and acts as an acoustic window, improving the quality of the images. For other types of ultrasounds, such as musculoskeletal or thyroid scans, usually no special preparation is needed. Always follow the specific instructions provided by your doctor's office or the imaging center. The ultrasound experience, seeing sound waves in action. What's it like to have an ultrasound? Let's explore the ultrasound experience, seeing sound waves in action. When you arrive, you may be asked to change into a hospital gown, depending on the area being examined. You'll lie down on an examination table. The sonographer will dim the lights to better see the monitor. They will apply a clear, water-based gel to your skin over the area to be scanned. This gel might feel a bit cool, but it's harmless and helps the transducer make secure contact with your skin for optimal image quality. The sonographer will then press the transducer firmly against your skin and move it back and forth over the area of interest. You typically won't feel any pain, though you might experience slight discomfort from the pressure if the area is tender. You'll be able to see the black and white images appearing on the screen in real time. The sonographer may ask you to change positions or hold your breath briefly to get different views. The scan can last anywhere from 15 minutes to an hour, depending on what's being examined. Beyond 2D, exploring 3D and 4D ultrasound technology. Finally, ultrasound isn't just flat images anymore. Let's touch upon beyond 2D, exploring 3D and 4D ultrasound technology. While traditional 2D ultrasound provides flat, cross-sectional images, advancements have brought us 3D and 4D ultrasound. 3D ultrasound technology takes multiple 2D images from various angles and uses sophisticated software to reconstruct them into a three-dimensional image. This can provide a more lifelike view, which is particularly popular in obstetrics for seeing the baby's face or features. 4D ultrasound takes this a step further by adding the dimension of time. It creates a moving 3D image, like a live video. This allows doctors and parents to see the baby moving, yawning, or kicking in real time. Beyond keepsake images in pregnancy, 3D/4D ultrasound can also have diagnostic benefits, offering better visualization of certain fetal abnormalities or helping in gynecological assessments and surgical planning. It represents an exciting evolution in how we can visualize the body using sound. And that's our comprehensive look at the amazing ultrasound device. It's a truly remarkable technology that uses the simple power of sound to give us profound insights into our health. I hope you found this journey through sonography enlightening. If you did, please give this video a big thumbs up, subscribe to Life of Medical, and don't forget to hit that notification bell so you won't miss our next episode. Stay curious, stay informed, and we'll see you next time.